Welcome to this webinar about the real planning challenges in pharma and medtech. People might join late, that's not an issue. For everybody that's here, the webinar is recorded. So in case you do need to leave for some reason, you will still receive the recording afterwards. So what I will first do is explain the agenda of the webinar and then introduce the panelists. We have Zoltan here today with us. Unfortunately, Michael could not join today, but Zoltan, with his experience, will be more than able to provide us with a lot of interesting insights. So what we are going to do today is first brief introductions, then we have a panel discussion, basically conversation between Zoltan and me about his experiences, insights, and that's about three topics. The first one is about planning under uncertainty. If you have new products, new markets, how do you deal with that in pharma and in regulated environments? Second is more about inventory. Because it is regulated, it's not always easy to transition inventory from country to country. There's a lot of restrictions that we need to take into consideration. And then the third topic is more around IBP systems, as well as the role of Excel AI and the role of planners during the next years. There will also be time for Q&A. I expect the main session to be shorter than that 40 minutes that we have foreseen here. But if you have any questions, you can put those questions in the Q&A section. If they are relevant during a specific topic, I might already actually ask them directly to Zoltan. If not, we just keep them for the end. So with that, I would like to introduce and welcome Zoltan Solyom to the webinar. Zoltan has...
Hi, everyone.
Thank you, Zoltan. You have a lot of experience around within pharma and medical devices. Before Coloplast, Zoltan has worked at Teva Pharmaceuticals. And right now, for the last years, Zoltan is supply chain director at Coloplast. So Zoltan, I don't know if there's anything that you want to add specifically, maybe where you're from. That's a nice personal touch for the audience so that they know where you're from.
Hi, everyone. I'm from Hungary. And as Ben said, I worked for Teva and now I'm working for Coloplast. I spent roughly 8 years in both companies and had a chance to look into not only into supply chain, but also into portfolio management. So how to lead a project in launching new products in a country. So I could get some feelings about how that works as well.
Yes, yes, definitely, Zoltan. Based on our previous discussions, you have some good experience in that. So, like I mentioned, Michael could not join, unfortunately. From my side, I'm Ben, one of the co-founders of Horizon Solutions, and I will moderate this discussion, let's say, but it's not really a discussion, it's more a one-on-one chat that we will be having. So with that, we will dive right into the first topic, which is about planning under uncertainty. So Zoltan, you already mentioned that role and experience that you have in portfolio management. So I would like to know from a perspective of forecasting for new products or markets that don't have any history yet for a certain product. How do you create a forecast for that? How do you start from that? And what are some typical mistakes that you see companies or people make when they do this?
Yeah. I need to highlight that at least in the world I have been experienced is that this part was strongly kept in the sales and marketing organization. So somewhere someone in the marketing who is responsible for the business itself or that area will decide or will make a plan how much they would like to sell from that specific product on that specific market.
Mm-hmm.
So how they find it out, I've seen a lot, I heard a lot, but this is really not has not been my desk. However, what I understood, this is a super complex task. I think it is complex because either you underestimate or you overestimate your potentials will have a significant impact in how the business will goes. So if you overestimate, let's say, then it means the operations will provide you with tons of products for that country, and if you cannot sell them, then sooner or later those ones will be scrapped. It's a cost for sure, and And of course, if you say that I'm gonna sell that much amount, then it will drive your financial targets as well. So
Yes.
it can be an unsuccessful project for the marketing department, that they cannot meet their targets at that point, which is quite awkward.
And
Yeah.
Zoltan, in that regard, you say it originates from marketing. Is that something where from supply chain you do challenge that forecast that they have based on some metrics that you might have for other products, or is that not something that you have seen in practice?
My experience is that if we had a chance to not to challenge, maybe, because actually they are the ones who should know it better than us, but at least we could have a talk, and we could make some kind of sanity checks about what they want. It always could bring some positive positive effects to that. So sometimes we could raise our hand as we were looking onto the project simply from an operational point of view, and we did not have any expectations from finance how much sales we need to reach. So we could highlight some circumstances, like what other stakeholders are on the markets, competitors, things like that, and also giving some insight about what our competencies from an operational point of view. So if they are dreaming too high, and this is beyond our, let's say, machinery capacity, then of course that target will not be met at all.
That's indeed a lot into that second point there, where you need to balance that growth ambition versus what's realistic from a supply perspective. So in that case, you're not necessarily going to challenge on, or you've seen is not that you challenge on the forecast itself, unless you see that there's constraints which mean that you would not reach their forecast, right? In that case, you really look at it and engage with them. But otherwise, you say, well, it's their responsibility. They have the most information from the market and maybe other indicators. So that's a bit how you've seen.
I would say, but this is really my experience, that it is good to have some level of trust with marketing. So if I'm saying that I know it better than how much they can sell from a product what they have never produced, or what we never produced, then it's like, okay, they could also challenge me why I'm saying that I only can produce that amount of quantity. So I think that's a nature of trust, and of course it should be based on a good experience. How do we collaborate with each other?
Yeah. Okay. That's for new products. For like for existing products, have you seen that supply chain does have a baseline forecast, demand plan also, or is that also originating mostly from marketing? You've seen.
Can you repeat the question, please?
So this is about new products or markets that don't have a history. Then it originates from marketing. In the case that there is already quite some history, is it still then marketing driven to some extent, or do you say no, there it's more supply chain that drives that through the demand planning?
In case there is a history, then I think we have a better chance to bring more knowledge into that. In that sense, it's also a situation where marketing used to have a push from finance. I mean, they have to deliver the targets, and that is why they might they could be more how to say, more optimistic in some cases. Supply chain and operations could have more pragmatic reasons. So if we see that the forecast, which has been represented a couple of months before, still cannot met, like only 10% of the forecasted volume have been sold for a half a year, then we have a better chance to challenge those forecasts and say that maybe the reality is somewhere below.
That kind of challenging and tracking of assumptions from different people or different departments like marketing, like finance, like supply chain. How have you seen this done in practice? Is it something where qualitative information is being tracked somehow? Suppose you have a system where you have those numbers, you have your forecast, whether it's for an existing or an old product, but let's keep that aside. You have the numbers, but then underneath that, you adjust that higher, downwards. Have you seen that being tracked very deliberately in systems, in Excel, even in some ways?
I don't know how it works in other companies. In my experience, there was one KPI that could easily demonstrate the result of the forecast, and that's the forecast accuracy. So comparing the forecast with the actual sales, and you have several ways to compare the actual and the plan. Leg -3, leg -1, whatever. Yes. But at the end, it's going to be kind of a measurement of how accurate that the forecast was. Then the second question is how the company wants to handle this kind of the KPI. Do they want to keep it as a hard KPI for marketing people? Yes or no? If yes, then it will have a direct impact in their activity. So there is less need to push from our end. If it's rather a soft KPI, then maybe it can be part of a reasoning why we would like to ask them to reconsider what they forecasted, and then we can also come with other informations like how many raw materials we still have, counting with the already produced volumes and the shelf lives. What do we see in front of us? How much will be expired based on what the system shows us, counting with the volumes had already been sold. So more data is required to show that can help the management understand that things are not just going in a way they should.
Okay. That's clear. And on the forecast accuracy part, I'm also clear. What I see in some companies is the concept of forecast value add, or just where you have like your baseline forecast, then adjustments made by people. You see whether those adjustments, the adjusted forecast, was closer to the actual sales than just the baseline forecast. And then you could even go into what kind of assumptions, why did they make these changes, right?
I think it's a funny thing because in the systems what used to be have in place are also able to measure what's the forecast accuracy, counting with the adjustment, with the manual adjustments where the marketing made, but also what would be the forecast accuracy if no one would touch it and we only let the statistics running. And it's always funny to see which version is going to win at the end of the month. But at least my experience is that in case there is a strong knowledge behind the manual adjustment, then it used to have a better result at the end. As we are talking about future and the statistics can only use the past. And in case there is a promotion in place, in case there is a new situation with competitors and out of stock from a competitor or things like that, there is a price change. These effects, which are really strongly moving the result and the sales, will not be visible in the forecast at all, in the statistical forecast. Sorry.
Yeah. Okay, it's clear. I see a couple of questions on this first out of 3 topics. Let me see. Somebody's asking a specific question, which is around if the forecast accuracy is off by quite a lot. So if it's, let's say, very inaccurate, what does the organization do as a result of that? So it's quite a broad question, Zoltan. So, but generally, if you see suddenly a big deviation, what's the next step? Is it you're going to root cause that, I assume? How do you do that? Do you go to the person who created the forecast? Do you look at the event that created it? What's the?
So you mean the 20% is the level of miss? So I mean,
just an example, yeah. It's just suppose you're very like
In my experience, if it's only so if you say it's the forecast accuracy is 80%, I would say that's quite a good one.
Yeah. But let's say
I
the question
also
is
have
more
an
about
I also have experience with the forecast accuracy of 20% really. So that was the forecast accuracy, and that's where we are strongly starting to raise our voice. But then the question is, in what kind of industry we are, because if the industry is where the overall cost of operations is not maybe the biggest one in the overall cost structure, then maybe it will have a lower lower importance of do we want to do anything about that. Or sometimes they're gonna say that that's the best we can provide in case we are talking about a market where we don't have that many information about how things gonna go. So let's take out as much as we can. In case we are talking about tender markets, if we are talking about emerging markets where we have a very limited amount of relations, informations, but we have patients, we have customers. So let's say we are trying to do our best from the information we got. That's what we used to understand from marketing.
Yeah. Okay. One other question is whether I see here, it is also something I've seen with other pharma and medtech companies. It's around data from competitors. To what extent that is being used to create a forecast. To give you an example, what I've seen in multiple companies is that they get access to or they buy information around competitors' potential stockouts. In some countries, it's necessary to share that so that that pharmacies, for instance, know about it and that they can recommend another product in that case. Is that something that you've seen also?
Absolutely, yes. So there are companies who are working with global data. Just not to say any specific one, but there are companies who are really watching the pharma industry and sharing sales data and volumes and everything else every month or every week or sometimes every day. So it is something available data. And the other part, what you're saying about the competitors out of stock, things like that, that used to come from the field. So the majority of the pharma companies are having a large team working on the field, and they are receiving information. These are just verbal ones, and they are channeling it back to the upper management to make them able to have better decisions.
Yeah. Okay. Thanks. I think that answers the open questions that I saw in the chat and in the Q&A on this topic. So then we'll move on to a more, let's say, or downstream step of planning, right? You have your forecast from where you will make a lot of decisions, amongst which how much inventory to keep. And of course, that also relates to service levels. I've done many other webinars and spoken to companies about service levels. It's always a balance, right? But in pharma and in medtech, it's quite different how you look at service levels, I assume. What is your experience with that? Because it's about patients, right? It's a bit of a more sensitive topic. So how do you handle that?
Yeah, I think the mainstream part should go quite similar to like any other industries. So wherever the sales is just happening with the normal or decent fluctuation and volatility, then the normal models are working. So you have a defined service level, X%, and you can build up a model which will, by using other data as well, it will let you know that if you want to have 95% of service level, then you will need to keep 3.6 weeks of inventory on the market continuously. That should be your target stock, for instance. And what's the safety stock you need to keep? So that's gonna work, I guess, in the same way like in other industries. The challenging part comes where the volatility of the sales is not that nice. And that can also happen quite frequently with pharma and medtech, as just like counting with these unexpected situations. Competitors has an issue, so I chance to go, or I'm quite dependent on raw material availabilities and things like that. So getting prepared for unexpected situations, my experience is that these models used to fail, and then it's the company decision whether they want to be more secured, like building up strategic stock, both from raw materials but also from finished goods, meaning that having higher inventories comparing to what the models suggest, or they're saying that, okay, I'm gonna live with that uncertainty and I will pay the other part. But that's not something I used to hear. So as you said, pharma and medtech, yeah, they are strongly dependent on the sales and availability of the product. And out of stock could have a much stronger effect at the end. So that is why it is. We used to have higher inventories. That's what I can imagine.
Okay. Largely speaking, the process is similar to other industries. The service level might be maybe a bit higher, the theoretical service level that you put, but it's a similar process. Now, around managing shelf life, is that an important one that you've seen directly in your business as well?
Absolutely. So if you compare it with another industry, maybe that's not that it will not be that strict unless you are talking about FMCG. Indeed. But here, when I'm saying shelf life, it means that the overall shelf life of a medicine used to be in between 1 year and 5 years, just give or take. The average is around 2 to 3 years, which sounds quite a good amount, unless you have a product which may be sold in a very small volume. So if you produce a full pallet of that product, then maybe that pallet would be sufficient for 10 years. So that's one challenge, and the other challenge is that in case there is a change in that product, which means that you have to provide that medicine or that the device to the market in a different way, with a different information, with different packaging or whatever, then it means you cannot use your existing inventory, and you have to reproduce that, and then you will scrap the rest.
That's also the obsolescence part, right? And the write-off of
exactly.
products.
Yeah. So in case of these, I think even if it's, as you said, it's harder because of the regulations, but in pharma and medtech, the potential of repackaging, the potential of postponement has a very big part in how to manage a good inventory. I don't know if you know about postponement. So it means that
it's an important one to explain it, because I think it relates to that third point there, where you want to. The problem that you're gonna solve with postponement in your explanation, I think, is that you need to have different labels in different countries, right? Or different rules on your package, so you cannot transfer it from location to location, right?
Exactly. So mainly we both in pharma and medtech, the country-specific version of a product is quite general. There are exceptions, many cases, but the mainstream is about having a country-specific version. You should also know that both the medicines and medical devices used to get reimbursements from the countries. So it means that part, and the bigger part of the price, is paid by the government, and that is why it is very strongly regulated. So that is why it can happen that the countries have special requirements how the product should look like. So we have country-specific items, and how to and changing in between country versions. It's not that easy. So it means that if you are able to hold your inventory in a neutral version, like it is The way I used to say the product is ready to use, but not ready to sell. It does not have the country-specific characteristics on it. And you can delay that part of production, being closer to the sales in time and geographically as well. Then you have a better chance to have the right amount of inventories on the market, getting a short lead time to answer on the market needs, and also be able to consolidate the demand from several countries in the same time. And then you can save yourself from having write-offs and out of stocks as well.
That's very good. I like that line. Ready to use, not ready to sell. I think that's a really good one. And I think it's something that a lot of people doing the planning directly, they cannot manage that part. But I think people managing the network or managing production, they really need to think of this. Where do you have that cutoff point where you're going to indeed make it ready to sell? And then beyond that, second step is probably where are you going to keep all of those products that are ready to use? At what location for which specific regions, right? So manage that central level versus the regional ones. But that's a really important one. I think that the planners themselves might not always be aware of that postponement importance. Okay. Let's move on to the final topic that I want to discuss with you, Zoltan, which is around systems, roles of different tools, and also the role of planners. So first of all,
Jay, we just got some questions about this. I'm just wondering if you want to answer them.
I didn't see it. Let me check. I see a couple of questions on whether you provision for obsolescence stock when you're planning the budget, basically.
Yeah, the short answer is yes, and the longer one is we are not only provisioning that, but also trying to do something with that. So we are having we are just using the forecast, of course, because that's what we have. By having the forecast, we are trying to define, based on the current inventories, what inventory will be expired, let's say, a year from now or 2 years from now. So we can start a conversation with the marketing guys, what to do with this volume. In case it's in raw materials, we can start to find out what to do with those volumes instead using for the original purpose. So for us, this is a continuous work on how to reduce that provision, or how to reduce the value behind that provision, not to have that write-off at the end.
Oops, I was on mute. I see one more comment about the MDR regulations, which I assume is medical device.
Yes.
Yeah, also the case ready to use, not sell, or also to ship. Okay, just confirmation.
Yeah, there it's I also can give an answer. So there it's a question whether the ready to use version of the product has any kind of characteristics which had been changed by the MDR regulation. That's a challenge, because then the new version of the Neutra product need to be introduced. However, it is also tricky because not all the countries are having the new MDR versions in the same time. So the registration of the products depending on the country by country. So it means that there is a quite a long period, at least years, where we are using two different versions of the Neutra product. One is which is already MDR, the MDR version for the countries where the registration was quick, and the old version for the countries where they are still waiting for the re-registration activity. But there again, it's good because you only have to deal with two different versions and not 2 times as many versions as as many country you have.
Yeah, indeed. Get at least bulk to some extent.
Yeah.
Okay. So moving on to process. First of all, SNOP and IBP are thrown around a lot, right? So here The question relates, in my opinion, mostly to the translation towards finance, to what extent you've seen that happen and to what extent you've seen that really being done in the longer term, right? With decisions that are 16, 18 months and longer out, rather than just focusing on the short term. Because many companies speak about this, but I see that many companies don't do it like it's actually supposed to be or as it's defined. How have you seen this in the industry?
In my current role, what I can see, it's more the operational side. So for instance, the long term plan of the IBP can be used for defining when do we need to build a new machinery from specific items, how many square meters we need in 3 years to be able to cover the market demands. So it's more like getting prepared for the future demand, how we're gonna produce those volumes.
Yeah.
That's the long-term part, and that is that at least in our case, that's widely used in the company.
Okay. To see capacity, which key investments are needed.
The capacity,
basically.
because that's a key. If you don't have capacity, and it's here, we are not talking about products which can be easily replaced by buying from another company. So if we are not producing them, then no one else will be.
Okay. How have you seen the role of, say, many people said it's probably two extremes play out recently, the role of both Excel, but then also of AI and any other advanced tools. To what extent have you seen both live next to each other, and to what extent do you think that will continue to happen during the next years?
Just back to the Excel, what I saw is, or what I experienced, the IBP and the Excel can live next to each other quite in a harmony, because in the past, Excel did everything what the IBP models are doing. Now it's more like it's not an extension, it's more like can be a fine-tuning tool. Wherever we need is where there is an unexpected situation, and the unexpected situation just easily cannot be covered with our planning system, because that's not something you can characterize. So easy stuff. It's the regulations. So you cannot easily change something in the production without having a documentation behind, which means that the operation cannot solve these kind of unexpected situations on their own. You need to do some kind of changes in the system, in the production plan, in the documentation, whatever. So it needs a strong focus. Just giving you an example, a very easy example. We used to have boxes, retail boxes, let's call or outer boxes, which are holding the product, and there used to be a label on that. And on the label, you have the information about the product. And you have a print tape, so the print tape, which is used to print the data on the label. That print tape is also registered, so you are not allowed just simply change that print tape, even if it's black and you have another black print tape with the same size and the same contact, but it has a different item code. It means you cannot just easily change it. You have to register the change. You have to document that change. That is why if you have a shortage, for instance, from a print tape, it means you have to intervene to what the plan was made by the system. And if you have a large portfolio, then you will have plenty of changes like this. Handle these changes without harming the production. You need to have, at least the way we are doing, you need to have a final check. Okay, this is the plan. The IBP for us can produce what's the ideal production plan. That's what we would be good to produce. That's what the market needs. But then what we really able to do order by order, that's where an Excel can help a bit.
Okay.
Check everything which could not be covered by the IBP itself.
Okay. So tools are good for the base plan, the initial proposal, but then Excel for the details, for manual checks, for something that's not always the same, right? Where you have some flexibility in it, and
Yeah,
you don't want to.
because yeah, as so until the plans are only in the system, it is just about it is just about having it on paper. But as soon as it goes down to the operation, it will have a strong, a very, very, very tough impact in case for any kind of reason they are not able to produce. So if they need to stop because they have a work order which is not manageable for any kind of reason, then it's a severe problem. They need to stop. They need to put it on WIP or somewhere else. But it's much more critical than having the best possible plan on paper first before handing it over to operations.
Okay. Okay, makes sense. In terms of the role of the planner and new tools, new technologies out there today, how do you see that evolve? Do you have a certain perspective on it?
Not that much, unfortunately. What I see that the AI can extremely increase the performance of an IBP. So how it is built into that. But until now, what I saw and what kind of challenges the planners used to have, I cannot see the chance for replacing that role with any kind of automatic solution. So this is really about experience, what kind of challenges they met before and how to solve them. That seems to be quite human.
Yeah. Okay.
In our case.
In the Q&A, there's one question around what kind of tools do you use yourself? The question is quite broad in here, so I don't know if it refers to tools around AI or not. I don't know. So I don't know, Zoltan, if you want to share anything during the Q&A, but the question is just, do you use what kind of tools for planning, maybe for maybe tools like LLMs or AI? I don't know the exact.
Yeah, well,
is there anything that you want to suggest on tools, planning tools or AI tools?
Well, we are having an advanced planning system. I do not want to share the name of the company for sure, but it's an advanced planning system, and it also it's a widely used one, and I think it works well for if everything goes in the right way. If something goes wrong, then we are using Excel to cover that, and we are also having BI tools to show and to easily get any information about where we are.
Okay, very clear. I think, at least from my side, I've covered the topics that I wanted to cover with you, Zoltan. I will still pause here and see if there's any other questions still from the audience for this Q&A section. Some questions were already asked and answered, but I'll still give it minutes. Are there still any topics that you think we should have covered, Zoltan, or you still want to add?
No, I think we covered a lot, and we could talk for days about this. So it depends on if there is anything the listeners want to ask.
Yeah, let me see. Let me see if you come on. Thanks. Some people had to leave earlier also, but let's see. Let's give it 20 more seconds to see if anybody still has a final question. We see in the Q&A also. Forecasting models, we will skip that question. Okay, so I don't see any further questions on these exact topics. So with that, we'd like to conclude the webinar, and I would like to thank you, Zoltan, for sharing your experience, your insights. Also, thank you to the attendees who asked some thoughtful questions. And with that, I wish you all still a good day or good evening, depending on where you are. Thank you, Zoltan.
Thank you so much. Take care, everyone.
Bye.